The doctor froze when he saw the chart. "Why wasn't this patient admitted last night?" he asked sharply. The nurse glanced at the frail elderly man in the bed and whispered, "He didn't have insurance, and he's homeless." By the time anyone decided he was worth treating, his condition had spiraled beyond repair. Homeless black veteran. Begged for care. What happened next will break your heart. How can a country send its heroes to war only to let them die in a waiting room? Comment your state if you're watching. Clarence Miller, 68, had once worn the U.S. Army uniform with pride, serving 2 tours overseas. Years later, arthritis and PTSD made holding a steady job nearly impossible. Without family or health insurance, he slept in a shelter and visited the free clinic when his chest pains started. That morning, he arrived at the county hospital clutching his service medal like a talisman. He hoped the emblem of his service would mean something. The triage nurse barely glanced at him, handing him a clipboard. He filled out the form slowly, pain radiating down his arm. Around him, patients with better clothes, younger faces, and private insurance were called in. Clarence sat quietly, believing his turn would come, unaware that every minute's delay was pushing him closer to the point of no return. The waiting room emptied and refilled twice before Clarence's name was called, but only for a quick check. A nurse took his vitals, noted an elevated heart rate, and sent him back to wait again. A young white man arrived, complaining of mild dizziness, and was immediately ushered in for observation. Clarence watched in silence, his chest tightening. By evening, the sharp pain in his jaw had him gripping the chair's armrest. He tried to stand, only to collapse back down. A security guard walked over, but instead of calling for help, told him he needed to sit still and wait. The hospital's charity policy technically allowed uninsured patients to receive emergency care, but in practice, staff often labeled them non-urgent to avoid costly admissions. That unspoken policy was killing people like Clarence. When a medical intern noticed his pale skin and shallow breathing, she rushed to the back to plead for a doctor. "He's not in the system," came the reply. By the time the physician finally agreed to examine him, Clarence could barely speak. The doctor's frown deepened as he listened to his heart. "Get me a crash cart," he barked. But the room was suddenly too busy, scrambling, chaotic, desperate, to undo the neglect of the last 8 hours. Clarence went into full cardiac arrest before they could wheel him to the ICU. The sound of the heart monitor flatlining cut through the sterile hum of the hospital. The doctor's voice, sharp moments ago, was now tight with frustration. "This didn't have to happen," he muttered. Staff exchanged uneasy glances. Everyone knew why Clarence hadn't been seen sooner. His lack of insurance, his homelessness, and the color of his skin had silently determined the pace of his care. For a man who had once run toward danger to protect strangers, his last hours were spent waiting in a chair, invisible in a room full of people who could have saved him. The war had taken his youth, but systemic neglect had taken his life. Clarence's death sparked outrage when a fellow shelter resident recorded a video of him waiting for hours, struggling to breathe. The footage went viral, igniting debates about healthcare discrimination, especially toward homeless veterans of color. Advocacy groups demanded federal oversight of hospitals receiving public funds. A congressional hearing was called, and Clarence's name echoed in testimonies as a symbol of betrayal. Veterans who saw themselves in his story began marching outside medical centers, holding signs that read, "We served, now serve us." Though no court ruling could bring Clarence back, policy changes were drafted to require immediate triage for all patients with chest pain, regardless of insurance. Clarence Miller was finally recognized, not for how he died, but for the dignity he was denied.